Hi friends, I am Dr. Pratham Rathod. I have done MD in Forensic Medicine. In today's video, we'll start with some miscellaneous poisons. First, we'll discuss about water intoxication. Deaths from water intoxication are very rare. Mainly, it occurs because of ingestion of large quantities of water or administration of large quantities of IV fluids devoid of electrolytes. Symptoms usually occurs include sudden expansion of cellular water. There is restlessness, weakness, nausea, vomiting, diarrhea, polyuria, oliguria, muscular twitchings, convulsions, and coma. The victims are usually become psychotic. Death usually occurs by cardiac arrhythmia, which is produced by electrolyte imbalance. Post-mortem appearance, history and low levels of sodium chloride in vitreous level can be found because of water intoxication. Potassium levels are also nearly normal to high, as it is rapidly released from the cells of the body after death, even in vitreous. Next, miscellaneous poison is insulin. It is a white powder and which is bitter in taste. It is usually given. Overdoses can occur because in diabetics. Symptoms includes weakness, fatigue, vomiting, dizziness, tachycardia. Because of all the symptoms are because of decreasing glucose. There is hypertension, anxiety, confusion, blurred vision, drowsiness, cramps, tremors, profuse sweating, tingling, heavy deep breathing, maniacal behavior, delirium, shock, coma, and follow to death. In severe lowering of blood sugar persists for many hours, there will be brain damage and death will also occur. Treatment is 10 to 20 grams of glucose orally in solution, that is oral high carbohydrate food is provided, or 50 ml of 50% glucose, then infusion is continued for 10% glucose is done, mainly to improve the glucose level. Medical importance, impairment of ability to drive a vehicle may lead to death. Homicide is very rare. The hypoglycemia, it may be lead to non-insulin automatism. Next is caffeine. Caffeine stimulates gastric acid, pepsin, and secretions from the small intestine. Caffeine is mainly obtained from tea and coffee. Significant amounts of caffeine are present in tea, cola, beverages, and chocolates. It decreases fatigue. Adrenaline and noradrenaline secretion is increased. Because of that, it can increase the basal metabolic rate by about 10%. Large doses can stimulate directly the myocardium to produce tachycardia, arrhythmias, and extrasystoles. It can also increase the oxygen consumption. It is also act as a diuretic. Doses of 200 to 500 mg may produce headache, tremors, nervousness, irritability, slight increase of blood pressure. At level of 1 gram per day, a combination of physiological and behavioral symptoms like anxiety-like presentations, insomnia, headache, and depression can also appear. With 10 grams of caffeine, there is grand mal seizures and cardiorespiratory arrest will develop. Withdrawal symptoms are commonly seen with caffeine. There is headache, yawning, nausea, drowsiness, lethargy, rhinorrhea, irritability, nervousness, and depression is seen. Fetal dose is 1 to 2 grams. Dose 50 to 200 milligram results in increased alertness, decreased drowsiness, and lessened fatigue. Next is formaldehyde. Formaldehyde is mainly used as a preservative for preserving organs. It is a colorless gas having a strong, pungent, irritating odor. 40% of solution in water is known as formalin. It is used as a disinfectant for preserving of museum specimens in plastic, in dyeing, hardening of cellular, and as a reducing agent. It gives off vapors at room temperature. It is readily absorbed in upper respiratory tract. It is metabolized to formic acid in liver and blood. Symptoms, fetal dose is 30 to 600 mg. Fetal period is 1 to 2 days. Symptoms include inhalation of vapor causes burning of eyes, lacrimation, coughing, constriction in chest, and palpitation. Ingestion produces symptoms similar to that of strong acids. It can also cause contact dermatitis. Chronic exposure can result in allergic contact dermatitis, chronic obstruction pulmonary disease, and optic neuritis. Treatment, stomach wash should be done with 0.1 solution of ammonia as it reacts with formaldehyde to form harmless methylamine. Activated charcoal is also helpful. Then saline catheter is done to remove the absorbed poison. Then symptom treatment is provided. Postmortem appearance, smell is noted on opening the body. The typical smell of formaldehyde is present if the person dies because of formaldehyde poisoning. Mucosa of stomach may be red, inflamed, and eroded with extravasation blood, or it may be hard and tough like leather. Intestine and lungs are congested. Liver may show fatty degeneration, and kidneys may be inflamed. Next poison is common tetrachloride. It is used as fire extinguisher, grease remover, and for dry cleaning clothes. Symptoms include nausea, vomiting, diarrhea, burning pain in mouth, throat, abdomen, dizziness, confusion, drowsiness, coma, slow irregular heartbeat, which may cause sudden death. Inhalation causes sneezing and mild breathlessness and all the other symptoms. Skin contamination can cause redness, irritation, and blisters. Fatal dose is 2 to 4 ml. Treatment is Astra System IV is given. These are my references. Thank you.